So, a quick recap of the hip. Remember, first we looked at the hip joint, and we looked at this predisposition towards stability in the hip joint, this naturally really well encapsulated bony structure of the hip joint. Remember, we saw the same bony kind of layering structure of the joint. So we have the bones, then we've got the cartilage, we also have the labrum, and then the capsule secreting the synovial fluid to lubricate, and the ligaments as kind of those passive stabilizing structures. Remember, these are the deeper structures that we tend to lay into when the muscular support isn't doing its job, either stretching out or the ligaments, or laying into and rubbing on the cartilage, or maybe laying into the labrum. There's a lot of different things that can happen in those deeper structures, but we're laying into those passive stabilizers. Then we looked at the active stabilizers around it. So we looked all around this trampoline structure of the hip. We looked first at the front, then we looked at the muscles. So I'll leave you a moment to kind of consider the answer to some of these. Remember, we had the front of the hip. We had the main hip flexor, which was actually two muscles. Remember, we had the psoas, and we had one here called the iliacus. Together, we called them the iliopsoas. And remember, their main action, hip flexion, and the other action was to create the lordosis. So we have that lumbar lordosis, and remember, we want that just that right amount, not too much, not too little, enough that we keep the integrity of the structures of the spine with the health of the curve, that important curve in the spine, but not so much that we're laying into the lower back, creating that hyperlordosis. Then maybe you can remember the antagonist to the iliopsoas, the primary antagonist. Remember, we have the iliopsoas taking the hip into flexion. So the antagonist is going to take it into extension. And the primary one we looked at here was the gluteus maximus. Remember, the issue we ran into with the gluteus maximus is this tendency to grip and clench and create compression around the sacrum and the SI joint and the lower back. And yet to still have a little bit of this weakness along the lower portion in this extension capacity. And we talked about that in the realm of backbends too, of being able to soften and not overly exaggerate this as we lift the hips into backbends, so that we can target more of the extension and less of the compression and external rotation. Then we looked at the abductors. And maybe you can remember the primary abductor we talked about first, here on the side of the hips more, gluteus medius. We talked about it in conjunction with gluteus minimus, going from the iliac crest to the greater trochanter. And its action was abduction, but we talked about its primary function was stability of the hip and the pelvis, drawing the hip into the socket there. And we talked about how important that was to not only the muscle itself, but to the health of the joint and those deeper structures of the joint. We talked about the main cue for this one in a class of being that ability just to hug into the socket. Now the antagonist, we mentioned to the abductors. This one's pretty simple. The antagonist to the abductors is going to be the adductors. And we talked about them as a group. Remember, as a group, adducting the leg and also working with the abductors to draw the femur and position the femur in the socket. We also looked at the TFL as an assistant abductor, and we talked about the TFL really coordinating this pulling on the IT band, and really as a result, the stability and coordination of the hip and the knee together. Then we lastly talked about the external rotators, and maybe you can remember the name of the one in particular we talked about mostly, running here. We have the piriformis, and then we talked briefly about the go-go cue, the gemellus, the two obturators, and the quadratus femoris. As a group, being a really powerful group to externally rotate the hip. Each one individually might be a little bit smaller, but as a group, they become a really powerful group to externally rotate the hip, along with, remember we talked about gluteus maximus too. Remember, we talked about the one structure that can be a little challenging here that runs usually underneath the piriformis here. Remember the sciatic nerve and our ability to gently stretch the piriformis without irritating the nerve in people where there is some sciatic issues going on there. We also talked about these as potentially usually being pretty strong, especially in the yoga community. It's a group of muscles we target a lot anytime we're doing standing side-facing poses. Warrior B, extended side angle, triangle, all of these, but our ability to find this balance between strength and also releasing these tissues for mobility's sake. And really, we talked about them all as a whole. Remember, each one of them having their own tendency towards tightness or weakness or maybe some combination of both, but them working together as a team all the way around. The rotators, the abductors, the extensors, the flexors, the adductors, like that trampoline, to help create this healthy community of muscles working together, supporting the hip, so that no one of them has to overly work, and that they all work together to create a harmonious relationship around the hip.